Cranial nerve 3, or the ocular motor nerve, is both motor and autonomic. It has two nuclei. The nuclei for the motor division is in the anterior midbrain ponto-mesencephalic junction. For the autonomic portion, it is the Edinger-Westphal nucleus in the midbrain. So the nucleus for the motor part of cranial nerve 3 is right here, the ocular motor nucleus. And right just above that nucleus for motor is the parasympathetic nucleus of the ocular motor, right here. The muscles innervated by cranial nerve 3 for the motor part are the levator palpebrae superioris, the superior rectus, the medial rectus, the inferior rectus, the inferior oblique. And for the autonomic portion is the pupillary sphincter and the ciliary. Now I'm going to be testing the ocular motor nerve, the motor portion, using the H test. Now, to perform this test, you should stand 2 to 3 feet from the patient and hold out your finger and have them follow your finger laterally to the right, up, down, back across, up, and down. They should be able to follow your finger without any noticeable nystagmus. Now I'll be testing the autonomic portion of the ocular motor nerve, pupillary constriction and dilation, using a pen light, or I'll be using a flashlight. To perform this test, you're going to use a flashlight, like I had mentioned, and you are going to shine the light on the patient's eye, and you should expect pupillary constriction when the light is shown on the eye, and pupillary dilation when the light is removed. Now, I'm going to be testing your eyes to the response of light. I want you to just relax and just look straight ahead and keep your eyes open, okay? And you'll test both eyes. If the results from the previous test were abnormal or ambiguous, then you will perform a near reaction test. To perform the near reaction test, you should hold your finger approximately 10 centimeters from the patient's eyes and instruct the patient to look at your finger and then to look off into the distance. Watch for pupillary dilation with distance gaze and pupillary constriction with near gaze. Okay, so I'm going to be checking your pupillary dilation and constriction. I want you to go ahead and cover your eye. I want you to look at my finger. Now look off into the distance. And look at my finger. And look off into the distance. Now cover your right eye. And with your left eye, look at my finger. Look off into the distance. Look at my finger. Look off into the distance.